Hi, this is Dr. Kaan at ACL Academy, and today I'm going to talk about quadriceps arthrogenic muscle inhibition, also a fancy word or term, basically talking about quad weakness, quad atrophy, quad deficits after ACL injury surgery. Before I get further into that, guys, if you found some value out of this page and has helped your ACL recovery process, please subscribe to the channel. If you have questions or comments, drop them below, and more importantly, share with a fellow ACLer that could benefit from these videos and tips that we put out on a weekly basis. So today I want to touch on quad arthrogenic muscle inhibition, also known as quad AMI, fancy term for quad weakness, quad atrophy, and almost every ACL goes through in some capacity after an injury and surgery. It is very, very well documented that everybody will experience some form of this inhibition, and some will last longer than others. There are people that deal with these quad deficits years out, and there are also some that their quad function comes back fairly quickly. So it's hard to say. We don't exactly know the reason of why this occurs, but just to kind of give you a broad overview of what's occurring, the nerves in our body exit our spine and provide two functions. One is the sensation to the skin. Second, some nerves provide what we call motor function, or the electricity for a muscle to work. For some reason, the connection in the mind to the body connection, or the wiring connection, has a bit of an issue when we have a knee injury or knee surgery. And the quad function, because of that, decreases, and we have a hard time activating and getting those muscles going. There are reports that after surgery, 1 to 3 days out, even quad peak torque or peak muscle function can drop close to about 90%. And for some, it just takes longer to get back. As I said before, we don't necessarily know why it happens. We know it happens. We don't understand why it happens longer for some people and then some for others. We have some theories. We have some evidence to suggest some things that we can work on and make it better. Having said that, still, we have clients here that we've worked with in the past where their quad function, their muscle strength comes back fairly quickly within a couple of months. They're 80% to the other side. You have other clients where months out, still struggling with quad activation, quad function, and getting that quad muscle firing. So a couple things that we do know, okay? Number one is how we can work on this, how can we make this better, is prehab. Right? After an injury like this, we do want to go through a good bout of prehab. If you can afford it with time, you want to give yourself 6 to 8 weeks or longer to make sure not only restoring range of motion, but we're making that quad muscle as strong as possible. We want to make sure that we're testing the strength so then we can compare it side to side and make sure that we do have good strength and those numbers are back up to where they need to be prior to surgery. The stronger you go in, the better you go out. Number two, there's a lot of evidence to suggest that swelling in the knee joint itself is going to inhibit that quad muscle. It's going to affect it. Even a 10 milliliter increase in fluid in quad function is going to inhibit that strength. So we need to take care of joint swelling. That's after injury, and of course, more importantly, after surgery itself. We don't want to continue to cause the knee joint to swell because it's going to also affect range of motion, but more importantly, we're just not going to get our quads to fire the right way. So that means time of our feet after surgery. That means using compression, such as wraps and knee sleeves, and elevation to get the leg up and elevated, gravity do its thing. Of course, activity modification. No weight-bearing exercises, not too much stress, so the knee does not get overworked and then responds with fluid. Because if you don't take care of the swelling and fluid early on, yes, your quad muscle is going to get affected, but now that swelling is going to last for months and sometimes even longer, and you're going to battle with strength. So a lot of evidence suggests that if you have knee joint swelling, your quad function is not going to activate and respond the way that you want it to. Number three, also big evidence suggests that using neuromuscular electrical stim early and often after surgery, it can help wake those muscles up. So we call this muscle stim. There are other names and terms for it: Russian stim, electrical muscle stimulation. NMES is neuromuscular electrical stimulation. Pretty much the same thing. They're devices that are accessible to you, that you can get at home, where if you set up the pads appropriately, if you set up the settings appropriately, and you utilize this at minimum 3 times a week, if not, we use it every day with our clients, and with the right amount of intensity, we can help that muscle recruit better, respond better, activate better. So there is good evidence to suggest that if you do utilize this early and often, it can make a difference and get your quad functioning better and earlier, and can help with the long-term strength gains of that quad muscle itself. So those are the big three take-homes. Everybody's going to deal with some sort of muscle quad inhibition after surgery. How we can take care of it is we do our job, do our work prior to surgery. We do our prehab. We get that quad muscle as strong as possible going into it. 2, we take care of that joint swelling early and often. The faster you can get that swelling out of the knee and keep it out of the knee, your quad muscle will fire better and activate more smoothly, and you will get going with this process. And number 3, using neuromuscular electrical stimulation early and often after your surgery, and minimum 3 times a week. If you can, every day, get yourself a home unit and make sure that you're using the correct parameters and intensity as a therapeutic dose to make sure that it's help recruiting the muscle and helping it activate it. Those are the 3 things that you could do to help combat the quad inhibition that every ACLer goes through after surgery. And that can really, really make a difference in your outcome, in the actual rehab process, and bring your quad strength back to where it needs to be. A huge take home for the recovery process, as a big part of ACL rehab is quad work and getting that quad muscle where it needs to be. If we can do some early things to take care of it, I do believe that people can have a much smoother process and have a more efficient and effective recovery. As if you have any questions, drop them below here. If you found some value in this video, please drop us a like and subscribe to this channel. And more importantly, if you have a fellow ACLer that can benefit from these tips and education, please share the ACL Academy page with them. This is Dr. Kaan signing off, and I'll see you next week.